like to, WorkBC would like to acknowledge with gratitude the Tsimshian people for permitting us to work, play, and live on their traditional and unceded territory. Just a little housekeeping before we get started. This event will be recorded. So if you don't, we suggest that you use your first name. So if you don't want to have your, be a part of the recording, we ask that you keep your video off. If you have any questions during the presentation, we ask that you use the chat box and your questions will be answered during the Q&A. During this event, Christine will be our technical support and she can be reached at 250-641-4483, or you can send her an email or even type a message in the chat box. So as Rita stated earlier, we have a variety of services that could assist you during your employment journey. So here we have our brochure. However, during COVID, our hours are going to be still 8:30 a.m. till 4:30 p.m. on Monday, Tuesday, Wednesday, and Friday. And on Thursday, we're open from 8:30 a.m. until 6 p.m. However, we ask that you give us a call at 250-638-8108 to learn more about our services. Or you can follow us on Facebook, Twitter, or Indeed. LinkedIn. If at any point during this presentation, any of the occupations are of interest to you, please do give us a call and we may be able to assist you with the funding and or the training that's required. And now I will pass the mic to Susan Biaggi.
Hello, everyone. Welcome. Thank you, Shelley, for that. That was very interesting. And I'm going to immediately turn the screen, over to Stephen Prinz, who is the recruiter with Northern Health. Welcome, Stephen.
Hi there, folks. So my screen should be up there for my presentation for you folks to see. And just a little bit about me. So I'm a recruiter with Northern Health. I've been with Northern Health for approximately 8 years, and I've been a recruiter for 10 years. And my work is to seek out individuals who are interested in working for Northern Health as an employer and share our work opportunities with them and kind of be strategic about showing our job advertisements or our job vacancies to the employment market around British Columbia and Canada, specifically for Northern Health. And what I've been asked to do today is speak to you folks about all of our options in healthcare. And I'm going to show you a bunch of different roles, approximately about 35. And we're going to go over what that work does, how you get the education for it, and what some of the prerequisites to get into that education for it. I'll also share with you some of the which jobs are really in demand in the labor market right now, which are we're seeking lots of employees for. And with me today, we've also have Lauren Ferreira, who is the support services manager for the Kitimat Hospital. And Lauren's going to be speaking directly to some of her positions that she has available and maybe seeking some potential new employees during this chat. So as we go throughout the presentation, please just drop your questions in the chat box there. I'm happy to answer them as we go. I just prefer to do that because it keeps a little bit more in the moment with what we're talking about and can be a little bit more useful too, I find that way. So basically, my presentation is going to be split into two halves. The first one will be specifically talking about our careers that you can get into with less than 1 year of training. And the second half, which will be the larger bulk of it, will be careers that will need more than 1 year of training. So we'll usually require some kind of bachelor's degree or other kind of post-secondary education, aside from a 1 year diploma. So getting into it, if you're not familiar with Northern Health, we are one of the 5 provincially funded operators for all of the healthcare systems in Northern British Columbia. So there is the interior, of course, down here, and there's the island health, as well as Fraser Health. There's a few of them, but basically we manage the geographic areas for the healthcare, and Northern Health is one, of course, in Northern British Columbia. We operate all the hospitals on the Hawaii and Queen Charlotte Islands, all the way over to the Alberta border. from Quesnel, Valemont, all the way north. So it's about 29 different facilities that we operate, different hospitals, healthcare centers, primary care facilities, and a variety of other different operations. So we have 8,000 employees. We're a very large organization. We're one of the largest employers in Northern British Columbia. And so within our organization, we have approximately 500 different job descriptions. So there's a lot of different jobs that you can do for Northern Health, anything ranging from, a physician doctor all the way to a housekeeper and anything in between. There's an incredible variety of work that you can do in Northern Health. And like I said, we're just going to do about 35 of them. And I'm going to try to capture that and give you a broad overview of what you might like to pursue in a healthcare career or maybe working for Northern Health. So like I said, we're going to talk about careers that take less than 1 year of training. And to start off, I want to focus on care workers because they are in extremely high demand right now. Care workers, also known as care aides or home care assistants, they all kind of fall within this category. And what these individuals do is they provide the real basic accommodating care that needs to happen for someone who is in a healthcare situation, for a patient that's in a healthcare situation. So this could be helping people, take a shower, helping them get up out of bed, eat their meals, go about kind of the minutiae of their daily life when they're in a compromised healthcare situation. A lot of these workers work within our residential care facilities or old folks home or extended long-term care facilities for people who have, maybe lost mobility, who are advanced in age, or just simply have a hard time taking care of themselves. That's what the role of a healthcare assistant is. And again, if you've ever been to a residential care home, you've met a care aide before. It's a well-paying job. You make $37,000 to $45,000 per year. And to get into this line of work, you do need a care aide certification. British Columbia is unique in Canada because we do require our care aides to be registered with the BC Care Aide Registry. And to do that, you do have to have that care aide registration. Prior experience will be insufficient for that. Even if you've, helped out your grandparents at home or something like that, you still do need that care aide certification. Right now, Northern Health, in partnership with the Ministry of Health, is working through a care aide registry, an initiative called the HCAP program, the Healthcare Assistant Program, where we are using government funding to provide direct education for getting the care aide certificate, because we're trying to add so many to our workforce right now. If you have any questions about that, if you'd like to, join the HCAP system and become a care aide, potentially a lot of your educational costs will be taken care of. Please email recruitmentsupport@northernhealth.ca, and we can make sure you get the information for that program, because we are looking for people, if you're in Prince Rupert and a couple other northern communities in the west there, to join this program. But overall, I highly recommend this profession. It's an excellent way to get into healthcare and maybe to branch into the other professions if you're interested. Overall, it's a great way to support your life because it's a good income. It's unionized, it has benefits. It's a great job overall. Another similar job to care aide would be our activity workers, but instead of the physical care of a patient, an activity worker will usually work with patients in long-term care facilities and kind of the mental care that they might need. So this is the playing games with patients, taking them out to community events, usually working through arts and crafts, just providing a lot of the mental stimulation that people need during their healthcare stay. So it's an 11-month program that you can do remotely. We don't offer the program anywhere in Northern British Columbia. Selkirk College is one of the programs that you can do it through, and you'll make approximately the same amount of wage, but this position is a lot easier on your body as it's kind of a, it's like I said, arts and crafts and working with individuals. And thank you for putting recruitment support in the chat there. I appreciate that. Very effective. And so these are kind of like the residential care roles that you might want to look at. They do pay well. And like I said, they work in care facilities in the community. So going to people's houses. If you have your driver's license, you'll require that if you have one of those roles, or within our primary care home or primary care teams. And I'm going to talk a lot about what primary care is later on, because it's very distinct from what people usually think of as a hospital care environment. So just to explain what it is. So we also do have our office careers, working for for Northern Health, we are really focused on taking care of patients. However, there's a lot of administrative and office-based work that we need to process and go through to ensure that we can do that effectively and track patient records and do all the different work that needs to be done in the background. So of course, we have our office administrative staff, and they have lots of different titles under office administrative staff, like, a medical office assistant and clerk, and that kind of all falls within those categories. You do need your grade 12 to do this work, as well as a 8-month course as an office assistant. And usually prerequisite for an office assistant course is grade 12. And to do the work, you're going to need the ability to type 50 words per minute. And I'm pretty sure the Work BC facilities there can help assess your ability to type how many words per minute you can type. So that's going to be between $31,000 to $47,000 a year. I would caution you with really focusing on this type of employment, though, as the market is very saturated with people looking to do this work. So one thing to keep in mind is that if you're dead set on doing this work, absolutely something could happen. However, you will be competing with a lot of other people. So just keep that in mind. And in addition, for you to look at here is our unit clerk roles, which if you've ever been into a hospital, been onto a nursing floor, a unit clerk is usually the first person you'll see behind a large desk if you come off the elevator or a stairwell. And they kind of work as like a traffic cop for the medical floor. They're going to be directing nurses and doctors and other healthcare professionals and patients to the rooms where the care is going to take place. And they're going to make $42,000 a year. And in order to get into this type of work, again, you'll need a grade 10 at least and the ability to type 50 words per minute. And you can do the education for this program at the College of New Caledonia in Prince George, and it's an 8-month course. This is an in-demand role, especially across all the different facilities in Northern Health. So I do recommend you have a look at this one if you're considering some administrative type work, highly detailed orientated work, and customer interfacing, because you will be directing clients and patients to the care that they need.
Stephen?
Yeah.
There's just a question in the chat at the top there if you wanted to answer that.
Oh, sure.
Do you see it up there? What jobs are relative?
Okay,
proportion?
Good question. So what are the relative proportion of jobs regarding activity worker with healthcare assistant? So for every activity worker, there's probably 20 healthcare assistants. So far more healthcare assistants are needed. An activity worker, though, I wanted to keep you aware of it because we do have vacancies quite often for them. As once again, the training for activity workers can't be found within the geographic regions of Northern Health, but you can do it remotely, like I said, through Selkirk College. So that's one to consider. But overall, the vast majority of the vacancies will be for a K-RAID or healthcare assistant. So thanks for pointing the question out for me. So moving on, we also need to talk about the laboratory in Northern Health. So during these COVID-19 days, the laboratory becomes a real key component to managing the outbreak. As Northern Health is at the real forefront of helping out the population, administering vaccines and testing for COVID positive or negative. And so lab workers are really key to that role of the positive and negative testing of COVID-19. So if you've ever been to a lab and you've had, say, some blood drawn or a saliva sample taken, chances are that was a lab assistant that took that sample from you. That's the key component of their work, is collecting samples and making sure that the kind of the chain of custody or chain of evidence of that sample is carried along with all the paperwork associated with you as a patient. So when your results come back, they go to the right person. So that's the key accountability and responsibility of a lab assistant. And this is a very in-demand role right now. The demand for lab professionals has exploded across Canada and North America, simply because, as you can imagine, COVID-19 puts such a pressure on them. I highly recommend this profession and this career right now. If you're looking for an available labor market, lab assistants are extremely in demand. This one is very accessible to do through Thompson Rivers University in Kamloops. And once again, it's an online course. You're going to need grade 12, as well as many sciences for grade 12 that you can do as possible. The more you have, the easier it's going to be on you. 100% you're going to need biology. 100% you're going to need chemistry to do this. So again, the education is a little bit more daunting than some of the other ones that we've spoken to, but it's so in demand that, if you've gotten to that level already, I recommend you check this out. And you're going to make between $41,000 to $46,000 a year. So it's a very comfortable career. And later on in this presentation, we'll talk about where you could ladder in to this profession into our lab technologist roles, where you're actually running the actual tests and kind of what that looks like as well. It's a 3 to 6 month program, so it's quite quick to get through. And also of note with the our lab assistants, while Northern Health is a major employer of lab assistants, there's also a lot of private labs out there that you could work for. So that would be Life Labs or any of the other private testing facilities that you might be aware of in your communities. And I saw your cat there, that was cute. So next we're going to talk about trades in healthcare, because we always talk about the healthcare related professionals, but we do have a lot of tradespeople within our healthcare systems to operate our facilities and make sure that they're running properly. So we do have our own power engineers in Northern Health. We do have to generate our own power systems, especially because we can't rely on the grid from our municipalities. We do have to maintain our life-saving machinery in case the grid goes down. So our power engineers maintain those systems, and you'll need a 4th class power engineering certificate, which you can receive through many of the colleges in Northern British Columbia. And you'll make between $50,000 to $62,000 a year. This is a highly saturated job market. Again, a lot of people have the certificate and can do the work simply due to the, the other industries in Northern BC, all the pulp mills and sawmills and lots of other facilities within Northern British Columbia use power engineers. So there's lots of people who do vie for these positions. Our maintenance workers maintain our facilities and ensure that they're working correctly and that the structure is sound and safe. And you'll need 2 years of related experience, usually within construction or some kind of trade is preferred to work as a maintenance worker. And you'll be making $43,000 a year with a minimum of grade 10. We also have Red Seal trades within Northern Health. So these would be our electricians and carpenters and et cetera, plumbers. We do employ those as well, but you do need a Red Seal, which it is over 1 year experience, but I just wanted to keep you aware of them that we do employ them. So I also wanted to talk to you guys a lot about support services. This is a profession that's really in demand in Western Northern Health right now. So, question. For the positions talked about already, are these full-time positions, or does Northern Health post mainly casual positions? So that's really a good question. That is really profession specific. So care assistants that we talked about have run the gamut. They can be casual all the full time, lots of vacancies for those. The trades that we talked about, 90% of the time you're going to see a casual. So as I go through the presentation, I'll try to mention kind of what the full-time equivalent nature of the postings is, just so I can keep answering that question for you. So
Stephen, I'm just going to interrupt. We'll record all those questions for the Q&A later. So yeah, don't worry about monitoring them or answering them. We'll take care of it. Sure. Yeah, we appreciate it. It's just
no
hard to do if you're presenting.
Yeah, no worries.
Yeah.
I'll give you a quick overview of our support services careers, and then I'll ask Lauren Ferreira, my manager here on the screen, to chip in and provide some direct knowledge about some of these roles, as she does supervise all of these professions, and she is actively recruiting right now, so hence why she's here to speak with you today. So our housekeeping staff, as it sounds, maintain the cleanliness of our facilities, and they are key to the COVID response as well, as we can't have any surface contact and risk of COVID exposure. So very important people right now. You'll make $35,853 per year. You will need a minimum of grade 10 and ideally 1 year of experience. And so what would be applicable experience would be like if you've worked as like a chambermaid or a housekeeper for any of the hotels in the area. Our food service workers work within our kitchens to deliver meals and assemble meals. They'll make the same wage as our housekeeping staff. You do need a food safe level 1 for it, as well as your grade 10. If you've ever worked within the restaurant industry and food preparation, you're definitely eligible for this work, including fast food. So Tim Hortons, McDonald's, et cetera, that's all applicable for a food service worker. Our laundry workers, will make between $35,000 to $38,000 a year. There's a couple different levels there of seniority, and you'll need grade 12 for it. And if you've ever worked for maybe like an industrial laundry cleaning firm within Northern Health, like any of the uniform firms in around Northern British Columbia, you would be applicable for this role. Or if you've worked for a hotel for their on their laundry cleaning and staff, it's a very similar experience. Another role here that does require a certificate is our sterile processing technicians. So these individuals work within the sterile processing department. So if where they clean all of the medical implements, so they're entirely free of any bacteria or viruses, and they completely eliminate any risk of infection from cross-contamination on those medical tools. So they do have a degree of responsibility that garners a wage between $41,000 to $47,000. We do train them at the College of New Caledonia in Prince George, so their medical device reprocessing course. And you'll need your grade 12 certificate to do that. And of course, we have our cooks, make between $41,000 to $44,000. You'll need a certificate of cooking. And to get a certificate of cooking, you'll need at least grade 10. All the major colleges in Northern British Columbia offer the program, so you can definitely get your education through them. So Lauren, did you have any comments to make?
Sure, yeah, it's such an opportunity to be able to speak in a format like this. So I wanted to say, first of all, I'm really passionate about support services. I've worked myself in support services for 24 years in some capacity or another. And I just wanted to share with all of you that these are really good jobs. They're very interesting, and you make a real difference to patients, residents, clients, coworkers. And so they're very rewarding and satisfying. And the other thing I wanted to mention is that this is also a good jumping off point. So we do sometimes have people join one of these support services teams, and they kind of get their feet wet, and they spend maybe 2 or 3 years figuring out the system and seeing what's available, and then they choose. Maybe I want to go and get my cook certificate because this looks like it's my passion. Or maybe I want to cross-train. So you might be hired in housekeeping, but then cross-train in the laundry. So that's an option, but some people will say, I want to be a care assistant. Or an LPN, and I'm getting a bit carried away now, but there's more opportunities than that. We have LPNs that then go back to school to be RNs. So sometimes these support services positions are the entry point, the jumping off point. And, reach out to your support services managers. We're all happy to answer questions and to give you more information, share the opportunities that are available directly in our sites. And certainly, if there's any questions, I'm happy to answer them now or later.
Thanks, Lauren. And just a question here in the chat. I'm hearing that a red seal is not required for cooking jobs.
Yeah, it's a certificate from Culinary Arts Program.
Yeah, exactly. It's not a red seal. It can be a diploma or certificate. You can also do experience in lieu. Certificate is preferred, but if you have 5 years as a cook, saying within like a chain restaurant like Boston Pizza or something like that, we would certainly look at your resume and consider you. One thing to keep in mind about all these support service roles is that these are unionized. These are roles where you have a defined healthcare benefits package, you have a clear system of seniority, and you have an ability to bid internally on positions before external candidates are eligible to apply on them. So the job security with this work is really profound. There will always be work with Northern Health, and this applies to all professions, but especially support services. Our ability to provide hours for you is not incumbent on the price of coal or lumber or some other commodity. We're always going to be here as long as there's people within our communities. So if you're looking for economic security, healthcare is a great place to be. You will always have a safe place to work within Northern Health. and any other healthcare worker or other healthcare careers. So I highly recommend it because it's only going to get more in need as our understanding of pandemics progresses and as our population gets older, more healthcare workers will be needed. So I'm going to move on with the presentation here if you don't have any other questions. Will make one more point though, that you can contact me as a recruiter. My email is stephen.prinz@northernhealth.ca. And if you have any questions about our support services roles here, either if you're in Kitimat, if you're in Terrace, if you're in Prince Rupert or Smithers, or you have an interest in any other community in Northern British Columbia, I can help direct you to those managers to secure you some conversations with them and maybe move forward with an interview. Okay. And of course, if you're more comfortable with the Work BC team, they can refer you to me as well. Okay, so moving on, we're going to look at careers that need more than 1 year of training. So of course, nurses, everyone's aware of the need for nurses in British Columbia. Often it's in the news if you follow that. You'll often hear about the extra nurses that Northern Health or Fraser Health needs. And there's a reason for that. About 60% of our workforce is a registered nurse or a nurse of some kind. And I wanted to take you through the different types of nursing registrations that you could be. So these are the different recognized legal practicing nurses within Northern British Columbia. And so all these nurses need some kind of, have to pass some kind of certification exam with the organization body that oversees the professional practice standards of each nursing profession. So we talked about care aides or healthcare workers before. Often people will start out as a care aide if they want to be within the healthcare profession. And later on, they're like, oh, I really like being, a care worker. I want to see how far I can go with this. They might ladder into, say, like a licensed practical nurse later on, or short form is LPN. And that's a two to 2.5 year diploma. And you'll make $49,000 to $56,000 a year. And licensed practical nurses are really focused on the hands-on care quality of a patient, but they do have a lot of restrictions on what they can and can't do. So they can't give patients medications. They have to consult with a registered nurse or a doctor to implement patient care plans. And overall, a lot of their duties overlap with that of a care aide, but with a little bit more independence and autonomy. A registered nurse is the most common nurse that you'll find, and they'll make between $63,000 to $96,000 a year. And you'll need a bachelor's of nursing, which is a 4-year program. And you can access a bachelor's of nursing through Coast Mountain College, as well as College of New Caledonia in Prince George, and Northern Lights College in Fort St. John. So it's a fairly accessible program in the north. For a bachelor's of nursing, you will need at least 2 of the 3 grade 12 sciences. I recommend chemistry and biology as well. And I'll get into the different types of registered nurses you can be, because if there's a discipline within healthcare, there's a type of nurse associated with it, and I'll share those with you in the next slide. Of course, we also have our registered psychiatric nurses working within our psychiatric care facilities and our outpatient firms, working with our patients either who have mental health or addictions, healthcare needs. They're going to specialize in that. And at the top of the profession scope of care is our nurse practitioner. So if you haven't heard what a nurse practitioner before, they are sort of like a combination of a doctor, physician, and a nurse all in one. And we often use them in our smaller, remoter communities. You'll see a lot of them on, the Queen Charlotte Islands or Haida Gwaii. They often work in our outposts with some of our Indigenous communities. And they're very distinct from nurses because a nurse practitioner can order an X-ray, can order medications, can order care plans. But key component to nurse practitioner is that they can diagnose, whereas a nurse cannot diagnose. A nurse practitioner can step into that role and provide that if need be. So usually the career path is you'll work as a nurse practitioner for a few years, or sorry, as a registered nurse for a few years. And if you want to carry on with the profession and get into diagnoses, you go and do a 2 years master's degree to become a nurse practitioner. And registered nurses and nurse practitioners are highly in demand right now. You'll see often news articles about it. You're paid well as a nurse, and it's an excellent union to be in. They're one of the strongest unions in North America, and the bargaining power that they have is really profound. So your wage rates will always keep up with the cost of inflation, and it's a very, very secure profession. So I mentioned the different types of nurses that you can be within Northern Health. This is just kind of a snapshot of them. These are the most common. The most common of a registered nurse is our medical surgical nurses. If you're ever in a hospital for a common procedure, say like a biopsy, where they're taking a sample of an internal organ or something, where they have to look at some type of diagnosis for it. Often you have to stay for 2 hours post the biopsy to make sure you're okay and that you're not bleeding internally. 90% of the time, that's going to be a medical surgical nurse just to make sure that you're stable and they know what to do in case things go south or sideways. And they'll care for patients that are acutely ill with a wide variety of medical issues, or, like I said, recovering from surgery. Most common, high in demand, most common, and you will. You'll want to probably differentiate from medical surgical nursing if you don't want to start out as casual or go into full time. Critical care nurses, also called emerge nurses or intensive care unit nurses or neonatal intensive care unit nurses, all work with patients that are dealing with life-threatening problems. So these are the nurses that often respond to car accidents, and as well, when I mentioned NICU, that is nurses that work with newborn babies and new mothers who are experiencing life-threatening birth results. Maternity nurses work with expectant mothers before, during, and after childbirth. And operating room nurses work with physicians and doctors who are providing operations, and they are very methodical nurses. It's a very interesting role in some of the things that they have to do. But they do more than just assist with the operation itself. They are the commander of the operating room. You often think of the physician as being the leader of it, but it's really the physician is there to do a couple tasks and then leave. But the operating room nurses set up all the equipment. They make sure it's all there. They order all the supplies. They work as a real partner with the doctor to make sure the operation happens. And a primary care nurse works on our primary care teams. And I'm going to talk about what primary care is on the next slide in detail, because it is what we see as the future of healthcare. And it's important for everyone entering the healthcare system to know what that is. But essentially, they work as a nurse in the community, going to patients' houses, working with teams of different healthcare practitioners, not just nurses. And I'll explain what that is, like I said, later on. And a residential care nurse works within our residential care facilities for our long-term care patients on some of our continuing and long-term care needs. So often they'll be there working with our patients for ensuring that they get their medications at the right time. They're often working with dementia patients or patients who have no capacity to care for themselves. And they are absolute heroes with the work they do. And as we saw with the COVID outbreak, within our healthcare facilities, they're heroes for what they do. So in-demand profession as well. So primary care is, with a lot of the verbiage you'll see here, is kind of healthcare specific. But what it is to put it in very simple terms, classical traditional healthcare was you went to your doctor diagnosed you, and your doctor would send you along to different professionals or healthcare providers to sort out your problem. And you as the patient had to know the language of what was going on with you, had to understand it to a degree and be able to communicate that to the different healthcare workers that you're being referred to get the treatment that you need. Primary care model of healthcare is where you're assigned a team of different healthcare workers based on the diagnoses that is made, and they will jump in and prompt you for the care that you need instead of you having to advocate for yourself. And this becomes more and more profound as you get less capable of making your own decisions, especially later in life and through any mental health and addictions type problems that you might be dealing with. So for the example of a primary care nurse, you might be diagnosed with some long-term disability of some kind. A primary care nurse will be assigned to your care team who will regularly visit you, alongside with a physiotherapist who's going to take you through exercises to get you back to your ability of function. And overall, you can think of it, primary care, as a team of healthcare workers pulling you through the healthcare system instead of you pushing yourself through the healthcare system, if that makes sense. So for every healthcare role that we're going to be talking about here, that's direct hands-on patient care, there is going to be a primary care form of it. So let's talk about the diagnostics careers. So these are the professions where doctors or nurse practitioners are calling upon these individuals to help make their diagnosis. And most of these do it through some kind of image generation, some kind of picture of what's going on internally with the human body. And of course, we're all familiar with X-ray technicians, where they're one of the more recognizable roles within Northern Health, or sorry, within the healthcare system. It's classical, you know, the picture of a skeleton. And they're going to make between $53,000 to $89,000 a year. It's a 2 to 3 year program that you can do through the College of New Caledonia and Prince George. This is a highly saturated market, though. You will be competing with a lot of people if you're interested in this profession. However, if your heart's set on the role, by all means, go for it, because there is work available. But when you graduate, you can expect to only work as casual initially. And all of these will require 2 out of 3 of your grade 12 sciences to get into the programs, at least. Medical sonographer is in extreme demand right now, highly in demand role. My vacancies for medical sonographers go vacant for years on end, and they are critical to the healthcare system because physicians can use these scans that medical sonographers use to see the soft internal structures of the human body. Most people, in layman's term, will see a medical sonographer during a pregnancy to see what the status of the fetus is, but a sonographer, like I said, can scan any soft tissue of the human body. So that include any organ, kidneys, hearts, etc. They can also scan ligaments to see what the status of them is, any veins within the human body. Anything that is essentially not a hard structure, they can scan, aside from the brain. And so they are extremely important to the medical profession. I just was trying to hire a new graduate of the College of New Caledonia program that was offered a $50,000 signing bonus for a firm in Alberta. Just $50,000 for a new grad, just to sign on. So super in demand profession. Highly recommend it to get into. Sonographer, is that a 2-year from start to finish, i.e. not a graduate diploma? So it is a graduate diploma. However, it is a fairly competitive program to get into because of the demand that I'm explaining to you right now. A lot of people going into that diploma might have a bachelor's degree already. However, you are eligible to apply to them if you just have grade 12 with 2 to 3 years of science. But good question. So I just want to reiterate, it's a very in-demand profession. So please consider it if you're looking into the medical roles. A biomedical engineering technologist is one of those roles that you almost never hear of. And I wanted to bring it up to you because it's one of those unique niche things that most people have never heard of. So all of these professions that you see here, the diagnostic roles and a lot of the lab technologists that you see, they use very complicated equipment, and that equipment has to be maintained. And that's the role of the biomedical engineering technologist. You can almost think of them short form as a mechanic for medical equipment. And we employ them in most of our hospitals. And within Northern Health and within British Columbia, they're going to make between $55,000 to $79,000 a year. And on the basic end of it, they might be maintaining wheelchairs or blood warming equipment or hospital beds. But at the full scale of things, working within, say, like the massive hospitals in UCLA, you could call these people roboticists. You can call them full-on engineers, mechanics. They basically maintain and ensure that those medical equipments are functioning. Within Northern Health, they also work on our X-ray machines, our ultrasound machines, and our MRI machines, which are all really important to maintaining our scanning and diagnosing capabilities within Northern Health. Not too much demand in terms of the labor market for these roles right now, as we only employ about maybe 6 to 8 of them in Northern Health. So I wouldn't recommend this if you're looking for an available job market, but I just want you to be aware of it because it's a role within healthcare most people aren't aware of. It's a 2-year diploma that you can do at BCIT in Burnaby, and it's a 2 or 3 grade sciences for grade 12 that you need for it. MRI technologists are usually an X-ray technician that have branched into this type of scanning. And an MRI technologist will usually scan the various structures of the human brain for a diagnosis. They'll make between $60,000 to $74,000 a year, and it's a 2-year diploma that you can do through BCIT and a couple other institutions in Western Canada. And we only have 3 sites that have MRI machines within Northern Health. That'll be Terrace, Prince George, and Fort St. John. And like I said, usually you start off as an X-ray technician to do this work. And we talked about lab assistants before. This is the next step as in the lab careers. And just as lab assistants, there is a high demand for lab technologists as well. So a lab technologist will take that sample that's been collected by the lab assistant and process it. And they will understand all the science behind what the doctor needs to know or the nurse practitioner needs to know to make their diagnosis. And they're going to either look at the chemistry of the specific case that's going on. So you've got 5 different types of specialties as a lab technologist, and you usually specialize in one of these or all of them. And the chemistry specialists will conduct body and blood fluid tests to detect various chemicals, hormones, and or drugs. They usually work within the private facilities, testing for work compliance for different restricted recreational drugs or performance drugs for athletes. That's the typical work that they'll do. Microbiology technologists will do tests on blood, bodily fluids, or tissue samples to detect bacteria, fungus, viruses, and parasites. Of course, they're at the forefront of the need for COVID-19. Hematology will measure blood cells and detect diseases and disorders of those specific blood. And transfusionists will specialize on typing the type of blood cells that you have, so A positive, et cetera, whether or not that blood can be transfused into someone else, because if it's the wrong type, it can put patient lives at risk. And histologists are really neat because they will take those little samples of human tissue, like we talked about with a biopsy earlier on. They will take that tissue and infuse it with wax and preserve it, and they'll cut little tiny slices of it and mount it on a microscope. And from there they can make a diagnosis of what is going on with patient's tissue, either like cancer or something like that. And so those are the different types of roles. Like I said before, lab technologists are in extreme demand right now. I've got about 15 part-time to full-time vacancies for lab technologists. Highly in demand profession. It's a great role to aspire to right now because all of the health authorities in British Columbia are looking for these people. I'm competing with Interior Health and Island Health and Alberta and all across Canada. We're looking for lab technologists. So I highly recommend this profession overall. And again, to start out into it, I recommend Lab Assistant, which is about a 2 to 6 month program that you can do online through Thompson Rivers University. Oh, okay, starting to lose my voice here. We also have our pharmacy technician program, our pharmacists. So you might be familiar with a retail pharmacist. We employ clinical pharmacists, which are specifically focused around working with our patients for the chemical intervention for whatever treatment they might need. They're very distinct from a retail pharmacist, which is more of a business owner. But we also do employ pharmacy technicians, which are responsible for the day-to-day operation of that pharmacy. So counting together the medications, compounding, putting together the various medications, and it's a 2-year diploma. Pharmacy technicians are in demand as well. We are looking for quite a few of them. On average, we'll have 2 to 3 permanent full-time vacancies at any one time. So that's another good profession that's available to get into. And of course, we have physicians. This is an 8-year journey to become a physician. It's a lot of money to become a physician, but you do make a lot of money to start out with. I could make an entire presentation about physicians, but I'm going to just leave it at there to let you guys know that we are after physicians. And we also have our career in rehab. So these are professionals that after the diagnosis has been made, the healthcare activities have been done, the patient's been stabilized, and we need to get that patient back to their quality of living that they had before their diagnosis or their injury. So you might be the most familiar with a physiotherapist. If you ever did, sports as a kid, you might have been involved with a physiotherapist to, help you get back to your level of sports ability that you were at before. But essentially, a physiotherapist will help when you've damaged a muscle or a component of your body, and a physiotherapist will help you get back to that level that you were at before. So they'll make between 61 to 98,000, and you'll need a master's degree to get into this line of work. And prior to that, of course, is a bachelor's degree. And we got another question here. Oh, apply for, okay, cool. And they're in high demand right now. A lot of my work is searching for physiotherapists. And if you ever want to pursue this career, you'll be able to do it in Prince George in the next year. We're getting a program at the University of Northern British Columbia, which is great news. And occupational therapists are distinct from physiotherapists because whereas a physiotherapist will get you to that state of ability that you had before, sometimes you just won't get there. You know, if you've had permanent muscle loss or you have a neurodegenerative disease like Parkinson's and you're struggling to raise a spoonful of cereal from a bowl because you're shaking too much, an occupational therapist will find a workaround so you can have a quality of life despite your limitation that you might have. So they're experts on wheelchairs, on ability assistance, just overall medical interventions to help you with that workaround that you need to get back that life quality that you had before. Same education level as a physiotherapist. Speech language pathologists and audiologists work with the hearing and speech functions of the human body. They often work with either young children or very old adults who need hearing aids. Similar level of education. Another profession, though, that supports all four of those master's level roles, though, are our rehab assistants. And they work with all of these professions to work through either the exercises or the explanation of usage of the equipment that a occupational therapist is prescribing. And it's a 2-year diploma. This is an in-demand role as well. You can do it. The closest school is Okanagan College in Kelowna, and it's a 2-year diploma. But again, high demand. If you're looking to get in the rehab roles, I really recommend this one. It's a great entry to it, and you are guaranteed work as a rehab assistant. So I highly recommend that one as well. And of course, we have our mental health and addictions professionals. We have quite the gamut of roles here, but the two ones that we have for the major employment across Northern Health are our social workers and our mental health and addictions clinicians. Our social workers primarily work with our patients to reintegrate into their communities after they've had some kind of mental health and addictions, medical intervention of some kind. And our clinicians work with our patients who have addictions or mental health problems, working them through their problems and helping them work through their prescribed medication plans. And they'll make between $55,000 to $75,000. All of them will require a bachelor's degree of some kind. The clinicians require either a bachelor's of social work or a bachelor's of arts in psychology or sociology. And to get in all those professions, you do need a grade 12 to get into the bachelor's education's programs. Not listed here, though, but I should have listed is our life skills worker, which is about a 1.5 to 2-year diploma that you can do through Coast Mountain College. And they are really focused on on resume writing and working with our patients for the daily living skills of being, accommodating whatever mental health or addiction medical problem that they might be having. That one is demand as well. We often are looking for life skills workers in Terrace, and you'll see those vacancies every once in a while for like our Seven Sisters inpatient mental health addictions care facility. And I wanted to show you one last offers worker career that we have within Northern Health that requires more than 2 years of education, which is our health information management clerks. So a key component of healthcare is the privacy of your healthcare information. If your healthcare information gets out to other people, it can be used against you. So that's why we have to keep it safe, right? So we don't want insurance companies to have it. We don't want employers to have it because they can use it to discriminate. And so that's Northern Health is responsible for your healthcare information. So we have our health information management clerks to keep that safe. And so only doctors and the people who actually need to help you with your healthcare have access to it. So they make between $54,000 to $60,000 a year. And you need at least 45 words per minute and you're grade 12 to be in that program. It's fairly in demand right now because, as you imagine, with our information and technology age, the exposure to healthcare information is so much more greater. So your ability to manage that risk as a healthcare information management clerk is that much greater. So high in demand profession. So those are all the roles I wanted to speak to. And I'm a bit of a cat guy. And here's a cat that I found who's asking a question. So much like the cat, please ask me any questions that you have, and I'd be happy to answer them.
Thank you, Stephen. That was wonderful. I'm just going to say a few things before we start answering the questions. We will be sending out a recording, so if anybody has to leave right at 11 o'clock, then just type your question in the chat and we'll address it. And we will also be doing the draw. And even if you've been here up until now, and even if you're not here at 11, your name will still go into the draw. So, and there will be a survey at the end of this job fair, so you will receive one in your email. Please take a few minutes to complete it. And I believe, Lori, you're going to be moderating the questions to present to Stephen and Lauren. So if you could just maybe start that, and I'll sign off. I'll mute myself.
You'd appear to be on mute.
Oh, I'm just going to admit someone. Sorry, if you have any questions, put them in the chat. And if you want to unmute yourself, feel free to ask a question. And it's always silent.
I have a question.
Sure.
Maybe I'm wondering about the equipment sterilization. How in demand, like how many positions, say, would they have at Terrace Hospital or Smithers or?
Approximately, I wouldn't know specifically, but 3 to 4 technicians. That number does change though as we expand our hospital operations. Terrace is getting a new hospital, so we can expect to see more people doing that work.
Okay. Is there openings typically, or is it one of those that aren't as in demand?
So you can expect to see vacancies for that role that are more casual in nature that are posted on our job board. That being said, while casual may not sound like you're going to have a lot of work, often it can be more than 40 hours in a pay period. And you can make more money as a casual than you can as a regular employee. So just keep that in mind.
Okay, thank you.
Okay, Stephen, it looks like there's a couple of questions in the chat there.
So first question there is sonographer in demand because there are not a high number of available seats in the training program? Partially correct. The big problem with sonographers and why we don't have many right now is twofold. One is that it's becoming increasingly the means of diagnosis for a lot of doctors. So high in demand. Two, sorry, I'm going to say 3 answers here. 2 is that we can often, the healthcare system could make money off diagnostic scans. People can electively have themselves scanned, you know, for just taking pictures of their infant while in utero. And 3 is that, yes, we don't have enough seats for the sonographers that we need, but that is compounded by the training for a sonographer is very, very hands-on. So the amount of people that we have to train sonographers, you know, other trained sonographers is limited right now. So we have a bottleneck. So that's kind of one of the main issues is that while we need sonographers, we don't have enough sonographers to train the new sonographers that we need. Because sonography, as you practice it, is a very, very, because you'll have your ultrasound probe pressed to someone's stomach and you have to capture that image live, right? You have to make sure that you're getting that image. So it's you have to have another sonographer there with you at your elbow. So without enough sonographers to train and do the scans we need for the medically necessary roles, that's the big bottleneck. Will training from another province be acceptable for sonographers? So sonographers are licensed as Canadian-based sonographers. So if you are practicing sonographer in Canada, you are licensed to practice in any province within British Columbia. So yes, if you're from another province trained, you are eligible to work for Northern British Columbia. What are the relative proportions of jobs with regards to activity workers versus healthcare assistants? Yeah, I did answer this earlier before, but I will answer it again. So there, for every 90 healthcare assistants, there are 10 activity workers. So there's way more demand for healthcare assistants, but you will see the odd vacancy for an activity worker. If you want to have a job that's a little bit less harder on your body than a care assistant, because you will be moving patients around as a care assistant, an activity worker will be a little bit easier on you. And one last thing I wanted to mention about any of the work within Northern Health, especially with our support services roles, is that you will always be working with town. You're not going to be going out to camps anywhere. You'll be back with your family in set periods of the day. It's a, as they say, typically a nice 9-to-5 sort of job. And you'll be close to home. You won't have to travel anywhere. So any information about the HCAP program? I'm not the lead for the HCAP program, so I don't have a lot of really specific answers for it. However, what I can do is ensure that the fine folks at Work BC Terrace and Kitimat, and as well as the other Work BCs in Northern British Columbia, can have all the HCAP information for you, so they can share it with you. And if you're really interested, I can connect you with the HCAP leadership team in Northern Health.
Maybe I'll just give a little bit of information. If you're interested in a healthcare assistant career, you can go straight into it now. So you can apply to be hired without the education, and they'll train you on the job. So it's a new initiative that's been put out by the province. And if you're interested in that, just give us a call at Work BC and we can give you some more information. I just thought you might have that all set up already, Stephen. So that's why I asked the question. Thanks.
Any more questions? If anyone wants to step up to the mic or put it in the chat. So when we say step up to the mic, we just mean unmute yourself. Stephen, are you okay to stay for a few more minutes? I think you're on mute.
Oh, sorry, absolutely.
Okay, good. In the meantime, while we're waiting to see if there are any more questions, I'll just talk about training opportunities. You may, if you're unemployed, you may be eligible to take a certificate or diploma program. And Rita, you can correct me if I say anything that's not absolutely correct here. But we can check eligibility, your eligibility for this funding at Work BC. It's normally, if you've been on EI, you don't have to be receiving benefits now, but if you've been on EI in the past 5 years, or if you've made over $2,000 in 5 of the last 10 years, you may be eligible. I believe if you've been on CERB, you may be eligible. Rita will probably be able to affirm that or not. And while you cannot use that funding to get a degree, you can go to school for, up to 2 years, depending on the tuition. And yeah, go ahead, Rita.
I'll just jump in a little bit. Yeah, for sure. CERB, any of the benefit programs make you eligible. You can do a lot of the things. We can't do the degree programs that were discussed, but most of the other ones are within our funding capabilities. Our tuition amount is $7,500. And also, it hasn't been confirmed yet, but they're expanding the eligibility parameters fairly soon, so that the EI eligibility may no longer be a factor. So just stay tuned. They may be broadening, and then they're making changes to the funding all the time. So it's always worthwhile, even if you think you might not be eligible, as long as you're unemployed, give us a call. You may be eligible to have your education funded.
Mm-hmm. It's a really wonderful time to be looking at training if you're in that situation, because it's who knows when these opportunities will come around again. So it's that's really great. I think there's so Erin is just saying through the Coast Mountain website, has all the information for the HCAP. Erin, are we ready to do the draw? Remember too, Erin, to include the people who have had to leave because they had other commitments at 11?
Yes,
Okay.
we have, everybody's on there. And so once you do the survey, you'll also have another chance to win a $25 gift card. So here's the gift cards. You can see that. Let me just share my screen here and get the draw going. Okay, so there's everyone on the wheel. Good luck. All right, here we go. Let's see who it's gonna be. Angie, congratulations. You win a $25 gift card to Tim Hortons. All right.
All right.
Close that. And I'm gonna save that. Oops, sorry. And I'm trying to stop screen sharing. And where's my screen? There it is. Okay. All right, so Angie, we will be in touch and get you your gift card.
So I want to say thank you to all the participants and thank you to Stephen. Thank you to Lauren for the excellent information. I just want to say that we will be sending the recording, and Stephen, we can send the PowerPoint, I'm guessing, the
Absolutely.
presentation along with that. So feel free to pass it along to anyone who may be interested in jobs with Northern Health. We put Stephen's email in the chat, and you can also contact us at WorkBC if you have any questions or you need any more information or you want to explore funding. All righty. And you will be receiving the survey right away with another chance for a $25 gift certificate. Are there any other questions? I think we're good. Right. All right, everybody. Have a wonderful day and keep an eye out for more job fairs from WorkBC Terrace. Bye-bye.
Bye-bye.
Bye. Bye, Fernando.